Hello everyone. Today we're going to go over the physical exam for a patient that is suspected of having Sever's disease or comes in with a chief complaint of heel pain. So the first thing we want to do is a thorough inspection of both the top side of the foot as well as the plantar surface of the foot, the toes, and posteriorly. We want to look for things like inflammation, bruising, or any ecchymosis that the patient may have. Next, we want to do a thorough palpation of the areas in and around the heel, both on the navicular bone here, the medial malleolus, as well as the heel itself, the lateral malleolus as well. Specifically, for looking for Sever's disease, we want to do the squeeze test, where we take our thumb and our index finger and palpate on the patient's heel, right on their calcaneal tuberosity, trying to elicit pain. Also, you can put your finger directly on the calcaneal apophysis and try to elicit tenderness that way as well. Next, after we do thorough palpation, we want to do some range of motion exercises. And first, we can keep their knee extended and try to dorsiflex their foot and get a sense of the angle that their foot makes, usually about 90 degrees or about 5 degrees past that. You can do that with the knee extended, but you can also do it with the knee flexed to take the gastrocnemius muscles out of the equation as well. Next, in the supine position, we can check for hamstring tightness or the popliteal angle. Basically, we keep the patient supine on their back, we flex up their hip and flex their knee simultaneously till their hip is about 90 degrees, and then we extend the knee slowly till we meet some resistance. And this angle is the popliteal angle. So theoretically, the patient could go all the way straight and that would be 0. And in this position, they're 90. So the more that angle is, or the closer to 90 it is, theoretically, the tighter that their hamstrings are. Something else that's really important is visualizing the patient from behind, where you can see the alignment of their hind foot and what their heels are really doing on the floor as they stand and also as they walk. In certain situations, if there's a lot of pain, the patient may even stand with the heel slightly off the ground or even walk in a little bit of a toe walking posture in an antalgic gait, trying to protect that heel like you can see on the right side here. One thing you can do is make the child walk on their heels, because that's going to put a lot of direct pressure directly on the heel. And if there is any issues with Sever's or any inflammation, that should be particularly uncomfortable.